Hi guys, I'm Chris Neeson. I'm an exercise physiologist and the owner here at Better Exercise Physiology. In this video today, I want to take you through exercises to activate the muscles of your deeper core. These muscles sit underneath all the outer muscles and provide a lot of support for your lower back and pelvis. I'm going to show you why these muscles are so important, how to switch them on properly. But firstly, let's talk about what these muscles are. We've got three muscles in particular. We've got a spine here that we can demonstrate with. If we're looking at the pelvis from the bottom, the two sides of our hip bone, in the middle here we have our pelvic floor. It sits underneath the bladder and lifts up to support and also draws each side of the hip bone in together. From there we have our transverse abdominus. It attaches to the back of the spine, wraps around and then it attaches at the front on either side, and it sits like a corset to draw everything in and tighten. The last muscle, we've got those three muscles, the last muscle of our deeper core is our multifidus. It runs at the back of our spine. It just sits in on either side of these points at the back of each of the vertebrae. It provides a lot of support at the level of each spine, so it attaches to each vertebrae as it goes down. Smaller muscles that support from the back. So altogether, these three muscles, they stabilise through the lumbar spine, through your lower back there. They stabilise either side of the hip bones by drawing them in and supporting them. Then they also stabilise at the back of the hip bones. If you've heard of your sacroiliac joint, where your spine attaches to your pelvis, so it pulls that in for support there as well. These muscles are quite often weak in people, or they're just plain not working. The problems are either sort of a long history of low back pain leading to it. It can be pregnancy, and particularly multiple pregnancies. Large births can also affect how well those muscles switch on. And then the last one's probably surgery. If we've had any abdominal surgery, typically those muscles just won't be working and supporting as well. What we can do though, we can go in and we can start to do some specific exercises to get them working a little bit better, get them functioning a little bit better, and get them supporting the back and the pelvis better. We need to be really specific when we're doing these exercises. If we're just doing sit-ups and crunches, it can help with your general strength, but we don't work those muscles of the deeper core. We don't work the stabilising muscles the way they should. So I'll show you in a second how to switch them on properly, and then how we can incorporate that into other exercise and into our activities of daily living and get strong through all of that. So we'll go down to the mat for these exercises and we'll take it from there. Let's start lying on your back with your knees bent. This is the most comfortable position for the lower back. All these muscles around the trunk can switch off, so we can get those deeper core muscles switching on without any interference. First thing we're going to do is find your hip bones at either side of the pelvis. We've just got bony parts that stick out a little bit. If you feel around, you'll find them just at the front of the hip. From there, I want you to step your fingers in about an inch and then down about an inch. So I've just got this soft part at the front of the stomach. If we relax the head back, we can feel those muscles softening underneath our fingers. To feel those core muscles switching on, just do a small cough under your breath, and you'll feel those muscles press up and tense up under your fingers. That's a contraction that we're trying to mimic. To switch them on, to get that contracting without having to cough, I want you to think about lifting your pelvic floor as if you're trying to hold onto a weed or stop that flow mid-flow. So it's just a lifting and tightening, and you should be able to feel those muscles just tensing up slightly, and then if we relax, we can feel them softening back down. We're focusing on switching on the pelvic floor. What happens when we get our pelvic floor switching on, the other muscles, the transverse abdominus and the multifidus, switch on as well. The pelvic floor sits like a bowl at the base of your pelvis. As we contract, it lifts up and flattens, and then as we switch it off, it sinks back down into that bowl shape. So think of that lifting and contracting as we lift the pelvic floor, and then relaxing and sinking back down. So again, feeling for those muscles, hands finding the hip bones about an inch in and then slightly down. I just want you to start with a few contractions. Lifting of the pelvic floor, feeling it switch on, feeling that tightening, and then feeling it relax back off. Holding it for a second or two, and then relaxing back down. This contraction is a light contraction. If we feel that cough again, That's going to be about 10 out of 10 in terms of how strong that muscle's contracting. We want to switch it on about halfway to about 5 out of 10. It's a very light contraction, but that's all we need to stabilise the lower back. If we tense up too much, if we try and really tense and lift up as tight as we can, we start to get all our other muscles switching on. Our six-pack ones at the front, the rectus abdominis, our obliques at the side. We don't want those muscles switching on when we're trying to train the core, the deeper core, how to work. We want to keep them relaxed and just isolate the deeper muscles. Once you've got that contraction and you feel confident in that movement, the next thing we're doing is adding a leg movement. So lift up the pelvic floor, hold it contracted, and then we're floating one leg up in the tabletop. Bringing it up into that right angle, keeping the pelvic floor contracted, and then placing it back down the mat. Relax those muscles in between, and then go again on the other side. Lifting your pelvic floor, holding it contracted, and then floating your leg up and placing it back down. We're just going to go side to side like that. In between each rep, I want to make sure you relax those muscles. What happens with our pelvic floor, if we overtrain it and overwork it, it starts to get over-tightened and it doesn't relax completely. If a muscle doesn't relax completely, it starts to fatigue. So just as important as switching the pelvic floor on and lifting up is letting it relax and switch back off and turn back off. So take a second or two to relax and switch back off before we go again and contracting. Starting like that, contracting, leg up and down, relaxing in between. If we want to make it a little bit more challenging, we can add in a second leg so it can be switching on. Bring one leg up, second leg up, back down, and back down, then relaxing. We can come up and stretch the leg away and then bring it back in and place it back down. So just building on those types of movements. From there, you might want to add in a pelvic floor contraction as you lift your hips up. So we're stabilising the pelvis as the hips come up and down. Okay, so the most common problems I see with people doing these core exercises, one is they don't know which muscles they're switching on, but hopefully with this tutorial you'll get a little bit of an idea of that. Another problem is that they're not relaxing, like I said, so make sure you switch off, even take a couple of seconds just to let that fully relax. Some people's muscles, they don't switch off instantaneously, so it can take just a little bit of extra time to let it all relax, and then you'll get a good contraction. If we work into that fatigue state, we lose that contraction. Another problem is when we're got an unstable pelvis. So as your legs come up, the pelvis is just shifting side to side as the legs float up each time. We want to make sure it stays still. We're trying to train that pelvic stability. And the last problem is either overactivation and people are tensing everything up and really gripping on, or quite often underactivation and they're not turning the muscles on strong enough. So what you can do that cough under your breath, feel that max contraction, and then bring it back to about 50% of that. Once you find that zone, just training that, trying to repeat those movements as regularly as possible, and you'll start to feel a lot of benefit for your lower back. It'll just start to feel more stable. The muscles will be switching on a lot better and supporting your lower back. If you can, I'd recommend going and seeing someone teaching clinical Pilates just to help check that you are doing it right. 1 or 2 sessions just to make sure it's right. Look up clinical Pilates in your local area. The good thing is once you get those muscles switching on properly, your back's going to be more supported. You can just go and do your general strength and your general fitness classes without worrying. But it's really important that you can get those muscles switching on if you have had some back pain, some pregnancy or some surgery. If you want any more information, you can find us at betterexercise.com.au. Shoot us through an email. I'll be happy to help you out or guide you in the right direction. Thanks a lot.